Good morning, folks. Ron Ray here with Turning 65 Solutions. We are in the middle of our 2025 video update series. So far, we've covered Original Medicare A and B. We've covered Medicare Advantage, Medicare Part C. We've covered all the letter supplements, F, G, N, high deductible G, high deductible F, K, L, and M. And now it's to that one part of Medicare that seems to be the biggest problem for almost everybody, whether you're on Original Medicare with a supplement or on a Medicare Advantage plan. Part D. Part D, Medicare Part D. D stands for drugs. Part D is the Medicare Prescription Drug Program, as you can probably see from the screen here. There have been some big changes to the Medicare prescription drug program for 2025. Most of those changes are as a result of the Inflation Reduction Act that went into effect in 2022. Some of them started even before that during the end of the Trump administration. Then during the Biden administration, they passed as a law the Inflation Reduction Act that started phasing in some changes to the Medicare prescription drug program. So the first thing that happened way back when, I'm going to give you just a real quick history lesson. During the Trump administration, through executive order or regulation, not through statutory law, they put a $35 cap on insulin. Now, the difference then, it phased in through the Inflation Reduction Act that went into full effect this year, is that $35 cap didn't apply to every type or brand of insulin, and it didn't apply to every health plan. Some health plans, some Part D plans were allowed to opt out of that. So it phased in, and then in 2022, the Inflation Reduction Act was signed into law and then began phasing in as a permanent, across-the-board $35 cap on insulin. That helps a lot of people. Insulin could be very expensive, downright unaffordable for a lot of folks, and it's something you can't live without. If you need insulin, you have to have it. So that's a good thing. That's going to help people. The next biggest thing that goes into effect this year, 2 months ago, today is February 25th, went into effect on January 1st, is there is now, for this year, a $2,000 cap on the amount of money that you pay out of pocket for your prescription drugs. So you remember there's these phases. You go through the deductible phase, then the initial phase when you're paying the co-pays, and then you hit that, donut hole, that gap in coverage everybody talks about. Then when you come out of that, you hit the catastrophic phase. Now, we still have phases, though there's no donut hole. You start out in the deductible phase, so your plan may or may not have a deductible. The deductible can be as high as $595. After you've met the deductible, you'll pay your co-pays until you reach $2,000. So if the total amount of money that you've paid out of pocket in 2025 reaches $2,000, you now leap over what used to be called the donut hole, that gap phase, and you leap straight to the catastrophic phase. One change went into effect last year in 2024 was they eliminated the cost sharing for the catastrophic phase. Prior to that, it was 95.5. You paid 5% once you get into the catastrophic phase. Last year, they set that to 0. So now this year, once you get to $2,000 out of pocket cost, you will pay 0 for your prescriptions out of pocket for the rest of the year. Then on January 1st, it all starts all over again. This is all good. This is going to help people. We don't know how many people. Some estimates from the latest data that we have say there's about 2 million people that are going to hit that $2,000 out-of-pocket maximum. We don't really know, but the bottom line is for people that do hit it and go over, it's going to help them. Other thing, we don't really know where the money's coming from. That's something for Congress and the people in Washington to figure out. What we know here on the ground in Texas is that once you hit $2,000, you're done paying for the rest of the year. $2,000, that still can be a lot of money for folks. It is a lot of money for folks. So if you hit that and you can't afford it, then what do you do? If you're not on another program like Medicaid or the low-income subsidy, extra help with Part D from Social Security, you have to come out of pocket, literally, like the word says, out of pocket for that $2,000. So they recognize that some people aren't going to be able to do that, or because a lot of that burden for all that extra money over $2,000 was put on the insurance companies and on the drug manufacturers. So both of these entities being for-profit companies, they're in business to make a profit. So what happens when you cut into their expense, or you add expenses to them, you cut into their profit margin, what do they have to do? They have to raise prices. And so they've raised deductibles, they've raised copays, they've raised premiums, they've eliminated some drugs from the formulary altogether. Some drugs you were getting last year, you're not getting this year. So what do you do if you're getting close to that $2,000 out of pocket? You go to the pharmacy your first time in January and you get a bill for $500-$600 for your first prescription. You can't pay it. What do you do? What are you supposed to do? Not take your medicine? No, they have a new program through Medicare called the Medicare Prescription Payment Program, P3M or 3MP, whatever they're calling it. It's basically what it's letting you do is, with the insurance company, they're financing at zero interest your out-of-pocket cost over the cost of the policy year. So if you go in January and your bill was $600, they'll let you stretch that out over the 12 months of the year. So you'll pay $50 a month for the rest of the year until you get that $600 bill paid off. Every time you go back to the pharmacy, if you want to stay in this program, they're going to keep adding to it till you get to $2,000. So if you had $2,000 in January, you're just going to take $2,000 and divide it by 12, and that's what you're going to pay for your drugs for the rest of the year. Then if you go over $2,000, they don't add to it anymore. They just zero it out. Now, one of the questions that comes up is, well, what if I can't pay that? What if I have trouble paying it? What if I don't want to pay it? We don't really know. We know that they will disenroll you from that payment program and won't let you get back in it until you catch up those payments. But we don't know if it's going to affect your credit. We don't know if they're going to start charging you interest on it. We don't know if they're going to start calling you, have bill collectors call you. We don't know. This is too new. None of these things were laid out to the insurance companies, and certainly not to the field force of agents who are out there trying to educate folks like you. So we've had a few people that have entered into this so far this year, and so far so good. We'll see as the year progresses. So that's the major changes to Medicare Part D. Some plans left, some plans came in, some plans consolidated. If there was companies that had 3 or 4 different prescription drug plans, they might have eliminated 3 of them, and now they only have one. Some plans went from $9 premium in our area to $50, and so those are big jumps. And you have that one opportunity, between October 15th to December 7th when you can make a change, unless there's some special circumstance that comes up during the year, like you had a declared disaster, like you had a hurricane in your area that was a declared disaster. They might give you a special enrollment period where you can go ahead and make a change now if you want to. Those are few and far between across the country. You have to check your area, call a local agent. Call us. We can answer those questions for you and get you signed up for the best plan for your current year. Or if you're on the best plan, that's what we'll tell you. We'll tell you you're on the best plan. Don't change. Don't buy insurance from us or anybody else this year. That's it. Part D, it hasn't really changed a lot the way it works. There's some things that they added to it. There's some things that they took away from it. Overall, at your level, at the street level where folks are walking into pharmacies and using these plans, it depends where you're at. If you're on expensive drugs and you go over $2,000 every year, it's good for you. If you've got a couple of generic drugs and that's it, or you don't take any drugs at all, it might not be so good because a lot of that extra cost is going to be spread out amongst everybody and you're going to end up paying more. So we'll just see. It depends on your perspective, but what we're going to do is just keep educating you and bringing you the latest information on everything that's available out there. So if you have any questions about this, give us a call. The number is 830-217-6711, or reach out to us on the web at t65s.com. If you enjoyed this video, if you found the information helpful, give us a thumbs up down below. That helps YouTube get this video out to other people who are seeking the same answers that you were today. Also, don't forget to subscribe to the channel. Click that little bell so that you can be notified when we upload a new helpful video. We've got lots more updates coming as we progress through this first quarter of 2025. So hope you enjoyed it. Hope you have a great day. Bye, folks.